So, Honourable Ministers, Excellencies, distinguished guests and friends, welcome to Driving Progress in Eye Health through Commonwealth Partnerships. My name is Brandon Artong. I'm the Regional Chair for the Western Pacific for the International Agency for the Prevention of Blindness, or IAPB, and Director of Global Policy and Advocacy with the Fred Hollis Foundation, and also representing the Vision for the Commonwealth Coalition. I have the distinct pleasure of facilitating this event in the sidelines of this year's Commonwealth Health Ministers Meeting, together with our co-hosts. Now, on the co-hosts, we have three wonderful, long-standing champions of eye health. The first, I want to just pass the apologies of the Honourable Minister of Health and HIV/AIDS of PNG, who was unable to get a visa and get here in time. So I believe he's still going to be joining you throughout the week. The second is the Honourable His Excellency Ambassador Dr. Leslie Ramsamy, Permanent Representative to the World Trade Organization and former Minister of Health for Guyana. And of course, standing in as well, we have Dr. Noor Fariza Nga, Deputy Director General of Health, Malaysia. Thank you to those co-hosts. Friends, global development is going through a period of immense change, and global health, it's fair to say, is really at the heart of that. We face major challenges, the hard job of balancing public health with other competing interests in a heightened environment and forging a way forward in a new world order that is yet to emerge. Now today's about remembering, reflecting and celebrating the Commonwealth. Your legacy of leadership, your enduring role to ensure that everyone everywhere has access to quality, affordable eye health, no matter who you are, how much money you have, or where you live. We remember in London 2018, leaders committed to eliminate trachoma, and that by 2020, the number of people at risk across the Commonwealth had almost halved from around 42 million to 24 million. We remember in Kigali 2022, leaders renewed their political support for eye care, especially for school-aged children, for glaucoma detection, and access to affordable eye care services. And we remember in Apia 2024, the home of my father, in the beautiful islands of Samoa, where leaders were urged to recognise the link between eye health and non-communicable diseases, particularly diabetic retinopathy, and to acknowledge the two leading causes of blindness, cataract and refractive errors, as NCDs. Now, we particularly celebrate the march towards trachoma elimination across the Commonwealth and recognise that Ghana, the Gambia, India and Pakistan having reached that important milestone for their people and populations. The Commonwealth's strength has always been in its partnerships. Partnerships across governments, partnerships with civil society and of course with technical law. Today, we hope to mark a new step forward in our journey to springboard towards a renewed global commitment of action, to be accountable in a new way for the long term, and a little sneaky point, if we can stride forward together towards a global summit on eye health. Now, more on that a little bit later. Now, coordination across platforms has been key to the Commonwealth's momentum on eye health for some years now. To tell us more, it's my pleasure to introduce Mr. Drew Keys, Director of Strategy, Policy and Advocacy with the IAPB. Drew, the floor is yours.
Thank you very much, Brandon. It's terrific to have you here this morning, chairing our Vision for the Commonwealth meeting. But also, Honourable Ministers, Your Excellencies, and our friends from the Commonwealth, terrific to see you all here early on this bright and sunny Geneva morning. It gives me great pleasure to welcome you on behalf of IAPB to this morning's event. I was reflecting that it is almost 10 years to the day since we started a program in Papua New Guinea, the Global Trachoma Mapping Project, or GTMP. Some of you may be familiar with that program of work. We started back in the middle of 2015, and the naysayers said to us it couldn't be done. It was impossible to do a trachoma mapping project in Papua New Guinea. But we had Commonwealth funding, and we had a group of partners, many of whom are in the room, represented in the room today. We had Sight Savers, we had the Fred Hollows Foundation, we had IAPB, we had local organisations, PNG Eye Care, the University of Papua New Guinea, the Ministry of Health, of course, of Papua New Guinea as well, who were determined that we would deliver a global trachoma mapping project. And 10 years later, I'm not going to steal the thunder of anyone else's presentations around the work that was done. But what I wanted to point out was that catalytic funding from the Commonwealth that drove those partnerships back 10 years ago had immediate impact. Yes, there was a GTMP, but within 12 months, there was also a rapid assessment of avoidable blindness. There were other epidemiology studies, because what that catalytic Commonwealth funding allowed for was training of the personnel in Papua New Guinea, of the ophthalmologists and the eye nurses. It allowed them to step up and to learn how to collect data in a way that had never been done in the Pacific Islands before. And so today, Papua New Guinea is held up as an example of having fantastic data for the Pacific Islands, despite many other challenges. And it's an example of how the partnerships for progress actually paid off very, very early and very, very quickly. And so it gives me really great pleasure to introduce this morning's meeting and to point out that during the next 45 minutes or so, we are going to see some highlights of these legacy examples of partnerships in the Commonwealth discussed. And as Brandon mentioned, sneakily, we are on the way, we are on the pathway to a global summit for eye health. And these examples that we will be seeing here today are excellent examples, not just for the Commonwealth, but for the entire global community in these difficult and challenged times. So Brandon, I'll hand over to you again, and thank you once again for being with us.
Thanks so much, Drew. Yep, round of applause, thank you. Now, it's my pleasure to introduce you to Dr. Noor Fariza-Gar, Deputy Director General of Health Malaysia. Dr. Fariza, as you make your way to the podium, as an ophthalmologist and public health professional, why do you think it's so important for multilaterals like the Commonwealth to have eye health on their agendas? I'll hand over to you, and the floor is yours, Dr. Fariza.
Thank you very much, Brandon, and the organizer for giving me this opportunity to be here and also co-host this wonderful event for today. So as we know that eye health is a critical component of public health, and with global implication for productivity, for education, as well as quality of life. So in Malaysia, we're addressing vision care, and it has been integrated as part of the public health initiative, which is reflecting the nation's commitment to comprehensive eye care. So by having this multilateral organization like Commonwealth, with the ability to influence international agendas and bring nations together, it plays a vital role in prioritizing and addressing eye health concern. So we know that globally, this visual impairment affects mainly those who reside in the low and middle income countries. So if we don't tackle this, it will continuously lead to the cycles of poverty, reduce educational attainment, and also limit economic opportunities, whereby the person is actually not able to show what actually their potential to do if they have a poor vision. So in Malaysia also, diseases like diabetic retinopathy and cataracts are leading cause of visual impairment. So as Malaysian population also ages and NCDs like diabetes become more prevalent, these issues are increasingly significant. So the role of multilateral organization, that what we want to have here is provide a platform for a member nation to share knowledge, collaborate research, and also access funding for public health initiative. So as the ophthalmologist and public health professional myself, the importance of multilateral organization addressing eye health lies in their ability to transform systemic issues. So nation like Malaysia benefit from this collaborative framework that tackle barriers to care. We can improve early detection system and also promote public awareness campaign. And this organization actually can also provide a unified voice advocating for eye health as a public health priority with ensuring sustained investment and also innovation. So eye health is more than just a medical concern. It is actually a social and also economic imperative. So with multilateral organization like the Commonwealth prioritizing eye health, we can continue to build to what we already success. We ensuring that vision care remains accessible and impactful for all. And this collaborative approach is essential for addressing the growing challenges posed by visual impairment and blindness globally. With that, I thank you. Brandon.
Thank you so much, Dr. Fariza. I'm going to steal that line. Eye health is more than a health issue. It's a social, economic and development issue. Let's put that one up in lights. Now, to close our opening remarks, I'd like to welcome Mr. Lane Robinson, Head of Social Policy Development with the Commonwealth Secretariat. Now, integrating eye health within broader agendas and supporting health equity is so very important, as we've just heard from Dr. Fariza. Lane, can you please share with us some reflections on this approach? And over to you.
Thank you. Thank you so much. Thank you so much, Chair. It's a pleasure for me to be here on behalf of the Secretariat and our team. We're very happy to be, continue over these many years to work very closely with this wonderful coalition of partners that have been driving this work on behalf of the Commonwealth. Indeed, in our team, that brings together experts and teams working on education, sports, youth development, and of course health. Our role has been to try to integrate this across, and we have seen great progress since 2018, when, of course, we get this great mandate to say, let's do something cooperatively together as a Commonwealth about this. So I'm very, very happy to know that over these many years, we've continued to provide that platform, that support, and that commitment has come from our countries towards eye health in the Commonwealth. That integration into education, integration into our focus on youth development makes a lot of sense for us, because we are trying to take our countries to a next level, to a higher level of development. And every time we look at those factors that are inhibiting that progress, we see small things, things that we could really work on as a Commonwealth, not often focused on in the global community, but sometimes we think we could put a light on that. And one of those major areas for us has been eye health. And so we are happy to see the continuation of this. And we hope that in the upcoming heads meeting, we will see further commitments. Despite what has been happening globally, we think we will still see progress, because this is one area where we can clearly demonstrate progress since 2018. There has been measurable, positive measurable moves in the right direction. And the coalition is what has driven this. The partnership is what has made this possible. All these partners that you see have come together here are the ones that has made this possible. And when you form partnerships, it can be difficult because you have institutional priorities, you have personalities to deal with, you have competing agendas. But on this agenda, there's something common. I think we agree there's something that we can do. And I think that vision, that hope, that value that we can make a difference is what has made this possible. I'm hopeful. I know it's a very difficult time for everyone, but I'm hopeful that, these kind of actions that we have seen will continue to grow and will become deeper. And we hope that the meeting that we will have here in the Commonwealth today will bring some hope to that as we talk about investing in health. There may be resources out there that we are not yet seeing. And when we see times of darkness, it's times when we should look towards where places of light are. So I'm hopeful that this meeting that we will have after this session ends, for the most of today, will give some hope that there's light at the end of whatever tunnel that we're looking into right now. And that by the time we get to 2026, things will be on track when we look to Antigua, perhaps, and beyond that, we will see a better day coming. So let me thank you all for the opportunity. The Secretariat remains committed to supporting this work, working with the coalition, working with Peter, with Drew and the team, and we will continue to do that as far as we can going into the future. Thank you so much.
Thank you so much, Lane. These gems, we can make a difference. Absolutely, we can. Let's shift gears, and I'd like to invite our panelists to the front, please. Sumrana, Dr. Fariza, Ambassador Ramzami, and also Dr. Fabrizio, if you can come up. Our panel here is really to speak about what Drew mentioned before. We want to understand what are the practical solutions, what's actually happening on the ground, and what are the strategies. And I'd like to start with you, Sumrana. And maybe if we can get Sumrana a mic if she's not got one. Ms. Sumrana Yasmin is the Deputy Technical Director of Eye Health and Uncorrected Refractive Error with Sight Savers. Now, Sumrana, Sight Savers has been a key partner in the global fight to eliminate trachoma. And the Commonwealth has played a catalytic role in driving political will in mobilising resources and that political action. From your perspective, why has the Commonwealth-led focus on trachoma been so important for the work that you do at Sight Savers?
Thanks so much, Brendan. Good morning, everyone. It's a pleasure to be here and be part of the conversation where we are actually celebrating some of the achievement. Can you hear me? Yeah, okay. Where we are celebrating some of the achievement within the eye care sector, primarily focusing on that cross-sector collaboration that we've been talking about and engaging in for a very long time. I think all of us know that Commonwealth is a very powerful and deeply connected organization when it comes to mobilizing political will, mobilizing resources at various levels, from global to regional to national levels. So having them as part of a catalyst for this initiative that primarily focused on eliminating trachoma across the globe has played a huge role. It managed to bring that diverse range of partners together in a way that we've never seen in the eye care sector before. And when I say diverse range of partners, that includes governments, non-government organizations, our international donors, local communities, and that has basically helped us to lead to this massive effort, which resulted into a very tangible action that is elimination of trachoma in so many countries. Having said so, we are living in a very different situation right now as compared to a couple of years ago where the momentum was huge. So what I believe is, while we are on the path to achieving that goal, I think we need to reflect and switch gears and see how we can further engage with Commonwealth to see what needs to happen, what needs to change if we want to achieve that target of no one around the world have this debilitating disease. And we manage to not only eliminate, but then sustain that elimination.
Yeah, excellent. Sustaining that elimination is really key. I'd like to bring in Dr. Fabrizio now, Fab. And Dr. Fabrizio, I'm going to talk from down here. Is that okay? Dr. Fabrizio D'Esposito is the head of region for the IPB in the Western Pacific. Thank you for being here. I'd like to unpack this conversation around data and evidence. Keen if you can reflect on the role of data and evidence in informing national strategy and monitoring progress towards trachoma elimination. Keen for your thoughts.
Thanks so much, Brendan, and a very good morning to everyone. It's an absolute pleasure being here. First of all, if I may, before I address your question, Brandon, I just wanted to acknowledge that I have been in contact with the Office of the Minister of Health in Papua New Guinea, and again, as Brandon says, he sends his apologies for not being able to be here in person. I'd met with him in person in Port Moresby a few weeks ago, and he was very excited about being here, but the good news is that he should be arriving in the next couple of days, so he'll be able to join the remainder of the proceedings. So I'll do my best to speak on behalf of Papua New Guinea, but I'm of course not from Papua New Guinea, even though I have worked there for quite a few years. I think the first thing to say is that Papua New Guinea is approaching a very important milestone. They have recently submitted the dossier for the elimination of trachoma as a public health problem, and it is my understanding that the endorsement of that is imminent. So hopefully we'll hear about that in the very near future, and it goes without saying really that would not have been possible without the support of the Commonwealth a few years back, which Drew has already alluded to in his opening remarks. It was support from the Commonwealth that initially made the mapping of trachoma a reality, and the evidence that was collected through that was crucial for what happened, what unfolded after that. We would not be where we are now without that initial commitment and support. The reality is that that evidence was only a starting point, however, and there's been continued support from the Commonwealth as well as from a number of NGOs. We've got some in the room today, the Fred Dollars Foundation, Site Savers, and also from governments, for example, the Australian government through their Department of Foreign Affairs and Trade and Australia NGO Cooperation Program. One other thing that Drew has already mentioned is that that data that was collected, the trachoma mapping piece, was only one of the many activities that were happening in Papua New Guinea when we talk about evidence. A couple of years after that, not long after that, there was also a national survey of avoidable blindness, which I had the pleasure of being involved in as one of the investigators. And all of the evidence that was collected has been used over and over again for a number of different purposes across the years in Papua New Guinea to inform practice on the ground. The trachoma mapping survey was crucial in terms of being able to identify where the hotspots were, and just as importantly, how we were tracking in terms of elimination. So crucial for monitoring and evaluation as well. Data goes beyond data, though, if I may say. And one of the things that I've seen happen through the collection of the data for trachoma mapping and also for the national survey is capacity building. The capacity of people on the ground to engage with public health questions and public health approaches and health system strengthening has increased immensely. I've seen people involved in that process now take on leadership roles in Papua New Guinea. For example, the National Eye Health Coordinator, and it's just been really wonderful to see the impact that initial commitment has resulted into, going forward. And then last but certainly not least, the efforts that have gone into integrating that response into health systems. And so I've seen some health systems change take place in Papua New Guinea, and I was there recently for a workshop on the new National Eye Health Strategy, and it was wonderful to see that all of this data is still referred to, and that they are now integrating eye health within the national health strategies, but also included eye health indicators within their national health monitoring and evaluation framework.
Yeah, excellent. And I want to come back to that topic actually, and sticking with trachoma for a little bit longer, I'd like to come back to you again, Samrana, actually, because Pakistan has recently eliminated trachoma, which is a wonderful achievement. But I'm keen to understand from you, Samrana, what you think this means for Pakistan, and what lessons do you think might be relevant for other Commonwealth members?
Thanks, Brandon. I think what it means for Pakistan is that around 4 million people will not be at the risk of contracting this disease. So that's a huge achievement. We recently achieved this milestone last year. The journey started in 20, I'm sorry, my dates. I'm a bit jet lagged, so apologies for that. I don't want to say the journey started in 2001 for us, and it was a long journey. And a few things why this journey was longer than what we anticipated was around the changing world for us. As a nation, as a low resource country where there are so many other competing priorities, where government resources cannot be allocated for a disease like trachoma. Having said so, having the strong partnership at the national level along with the leadership of Commonwealth organization, international organizations like Fred Hollows Foundation, CBM, Sight Savers, very strong role of National Committee for Eye Health with having their provincial chapter actively involved in the process has helped us to achieve that. A couple of years back, we experienced severe flooding in Pakistan, and that impacted our primary healthcare infrastructure in a way that 75% of that infrastructure was just gone. So I'm just trying to connect a dot that how that climate change related incidents, we are a high risk country when it comes to climate change. So how that has impacted our progress towards achieving this milestone. So for one of the message that I would like to pass on, that keep an eye on those trends in other countries and see how we can actually preempt and have those strategies in place where they do not experience such thing where suddenly it took us like just 9 months to do that field evaluation to assess the impact of the damages and then plan accordingly. Continuous engagement among all stakeholders have been a winning formula, to be very honest, for us. And then those periodic meetings where issues are discussed in open, organizations, implementers, open and transparent to challenge each other and then finding the ways to address those challenges. Again, something which I highly value and I believe that helped us to get to the point where we needed to be. And most importantly, referring back to Fab's point, that continuous monitoring and then identifying where we need to change the track, where we need to adapt our strategies and our interventions and have that constant as part of the process, along with appropriate resourcing. Because if we do not have resources allocated to address those sort of challenges in our budgets, then again, the progress can hinder. And just going back to that collaboration, the spirit of working together, having a strong leadership, identifying those leaders from community to national level who can help us to move forward is really important from what we have learned.
Yeah, I mean, one thing that stood out for me from what you just said there is what comes to mind is plan for the unplanned. I mean, that climate weather event, though it was sudden, you can kind of plan for these things. And to your point on resourcing, you need to have the resources in place in order to be able to respond, right? Dr. Fraser, I'd like to come back to this point that Fab raised a little bit earlier around integration, and really keen to get your insights in how iHealth has been integrated into broader national health strategies and monitoring frameworks in Malaysia, and if there are any lessons or thoughts around engaging other sectors in the work that you're doing in Malaysia.
Okay, thank you, Brendan. So as we know, Malaysia initially also in the same boat like most of the country, whereby the eye health is not be the major concern because they are looking at other like NCDs, diabetes, hypertension, cancers, all that. So it's always been underappreciated, if I can say that. But we, the team of eye care providers, which from the ministry actually looking this as one of the major issues, because we know, as I mentioned earlier, how actually poor vision can lead to poor performance in school, which lead to the poor quality of life. So we started maybe around 2018, maybe before 2018, when the first RAP was introduced in Malaysia. So that is actually a very good opportunity whereby we are telling our government about the needs for eye care. There's a lot of patient which requires eye attention, especially the cataract, which is a preventable condition. So we embark our strategies whereby we have our, we call it a mobile service of cataract surgery initiative. Mobile, not that we are doing it in the bus or something like that, but we go to the remote area, we go to the underserved population to perform the cataract surgery. So we have this initiative. We show to the government that we have to have this program. So it's not like, initially it's not like a top-down kind of project. It's from us that bring to the government to say that this is something that we need to do. So following that, we receive a lot of support from our mobile team that only happen in the Borneo, which is east of Malaysia. They support us to have even in Peninsula, also similar to go to the remote area. What we want is actually to have the service closer to the patient. Even though Malaysia is not big, but challenge for the patient to come, accessibility to get the treatment is still there. So when we do this, we actually able to cater majority of patient in the remote. But again, Brandon, we are not able to do it without any collaboration with private sectors. We also collaborate with the NGOs, and they are all ever willing to help us in this project. So now we are quite strong. And of course, if you ask me whether there's a special budget for this kind of activity, it's still not there. But we are managing. We are managing it. But of course, the next question is, can we sustain it if we don't have proper or good support? So I can see the government is actually taking this seriously now, as we are getting more buses, new buses for our project. And they acknowledge the need of the eye health. So when we talk about NCDs also, I'm sure you all know Malaysia is one of the country with a lot of diabetes prevalence. It's very high among our region. So we try to educate our people about diabetes and eye care. How actually by having diabetes, you will get blind if you don't treat your diabetes well. So not only focusing about giving insulin to all patients, make sure they get their medication, but what about the complication that they need to care about? Cataract also occur in a younger age if they have diabetes. So this is something that we are continuously doing to increase the public awareness about diabetes and eye care, and NCDs and eye care as well. So collaboration is very important. When we want to do this public awareness, again, the Ministry of Health, ourselves, we cannot afford to do it alone. So we need a lot of inter-collaboration. We call it whole of society, we call it whole of government in Malaysia. Then that spirit is actually happening now, and we are getting a lot of support from other ministry to ensure that we start from the early stages of life. From the primary school, we try to incorporate the needs for care of their nutrition, the care for eye health, all that. So that is very important, Brandon. And I think this Commonwealth organization is another platform that will help us to tell the government that this is not only a national agenda, but this is actually an international agenda. Yeah.
Absolutely. It is a global agenda indeed. I'd like to sort of get your reflections again, Fab, maybe from in the South Pacific Islands and this idea of engaging other sectors. And after, I'd like to bring you back in also, Samrana, and I'm thinking about we've touched on a couple of times, but coming back to children and maybe even eye health in the school. So first with you though, Fab, working with other sectors, what are you seeing in the Pacific from your work, either successes or challenges that you might want to highlight?
Thank you, Brandon. In the Western Pacific, we've got the largest number of people who are blind or have vision impairment. And some of the most common conditions include, of course, refractive errors. Cataract is still very much a leading cause of blindness. But you mentioned the South Pacific, and Dr. Farisa was talking about diabetic retinopathy. And Pacific Island countries have some of the highest prevalence of diabetes of anywhere in the world, and also some of the highest prevalence of diabetic retinopathy among people that have diabetes. The challenges are many, starting from workforce distribution in countries where the population is spread across multiple small islands, where often the number of ophthalmologists is incredibly limited and only located in one of those islands, and where travel for treatment can be really quite costly. Many of us, probably all of us in the room, will know that treatment for diabetic retinopathy requires multiple trips for to a specialist, typically over a long period of time. What I have seen change during the last few years, I've seen some really huge changes in a positive way. A few years back, there was a very large program of work funded through the Queen's Diamond Jubilee Trust, which included the Pacific, but wasn't certainly limited to the Pacific. I believe there was also work happening in Pakistan. And one of the key areas of focus was diabetic retinopathy. And what that did was really drove collaboration between different sectors, and in particular between the eye health sector and the NCD sector. So what I've seen change is much better integration of eye health services within diabetes services across many islands in the Pacific, Fiji being a good example, but also Papua New Guinea, Vanuatu and Samoa certainly. And going back to Dr. Farisa's point, I also saw services getting a lot closer to the people that need them. What has happened through that work and in the last few years is that increasingly healthcare workers, and not just our healthcare workers, have been able to provide some services to people with diabetes or who are at risk of vision loss from diabetic retinopathy. And there's been some really great examples of partnerships between NCD sector, primary healthcare sector, eye health sector, and also technology companies that have been able to provide the tools necessary to do the screening a lot closer to where they are needed.
Yeah, thanks, Fab. And challenges but progress, right? And Sobrano, I know this is an area that's particularly close to your heart and the work that you do. And, youth is very important also for the agenda of the Commonwealth. Can you talk a little bit about what you're seeing work really well in working with schools and bringing eye care into schools and working with children, and what you think is important for broader development agendas to work with schools and children?
Thanks, Brendan. I think we started the session today with a comment from you that eye health is not an health issue. And until and unless we see it from the perspective of broader development agenda, we would not be able to achieve that vision for everyone, everywhere. So when it comes to school health integrated programming, I'm just going to talk from Sightsaver's perspective a little bit. From our point of view, it's all about integrating eye health into school health policies, plans, and programs. And that means that bringing it out from the Ministries of Health's domain and bringing it into Ministries of Education's ownership. Because schools are a great platform to reach children. Having said so, we also need to make sure that as part of these initiatives, we are having those interventions in place where we are reaching out of school children as well. So that's one thing, how we can influence policies to make sure that eye health is included. And from the work that we have done in for example, Pakistan, Liberia, Nigeria, now in Tanzania as well, it has actually helped us to start conversations with ministries of education to start thinking about it. So there has been instances where school eye health program or school health integrated programs can be a starting point for school health policies in a country. So that I feel is really critical for us. We know that myopia epidemic is not going anywhere thanks to so many factors, including the changes in lifestyles. So we need to be very careful and we need to be very action oriented when it comes to making sure that we are reaching children as early as possible when it comes to correction of refractive error and other vision impairments. Having a very strong focus on health education and promotion, I feel is really important. That social behavior change component of any school health intervention is the key to make sure that if I just pick uncorrected refractive error, it's not about dispensing those spectacles, it's about making sure that children are using them appropriately. So just need to make sure that that element is addressed in our programming across the board, and then having a really strong component of research and learning, and then be able to share those learning not only just in context of that particular country, but with the region at the global level to see how those interventions are impacting any change and if what is working in one place can be replicated in another place or not. And I'm just going to plug a little bit around
No,
gender.
go ahead and plug, yes.
That is also something which is very close to my heart. So we know when it comes to the prevalence of vision impairment, it's higher in women and girls. And when it comes to access to care, it's less. Again, going back to whenever we are designing or planning and implementing our school health interventions and then programs, just make sure that there is an equitable access. There is a component where we are making sure that we are reaching women and girls as much as possible, just to get that balance over a period of time.
Yeah, absolutely. We've got some time now, and keen if there are any comments, thoughts, suggestions, other reflections from the floor, actually. I'll give you a couple of minutes to think of something, but there's one thing that I wouldn't mind picking up again from the panel, and happy for any of you to answer. And you did touch on this a bit earlier, Dr. Fariza, around the private sector. I'm keen if you can share with us any good examples where there have been public-private partnerships in particular, and working with sectors around different types of social impact, or anything around that investment area as well. Any comments, thoughts anyone want to share on that front?
Right. Thank you once again, Brendan, for the question. So for Malaysia, one of the good example that I can share about the public-private partnership is the establishment of our static cataract center in the heart of Kuala Lumpur. So the cataract center is actually collaboration between the Ministry of Health and our Islamic Religious Association, one of the biggest association in the Kuala Lumpur. So they are using, they gave us some amount of money and asked the ministry to do a center specific for cataract. Why this was given the idea? Because we know that cataract is one of the preventable blindness. But in hospital, that doing the cataract surgery is not easy to perform a lot of cases per day because of the challenges in the OT time, the the amount. I'm sure if you are doing involved in the hospital management, the challenge is there. So we have a lot of backlog cases. So when we present this, we ask about, we've been asked why that you have a lot of backlog cases of cataract blindness following our RAP assessment. So we give the justification. So they give us some money. It's not a lot, but we're able to have a good center. It's a one-stop center. We do the pre-operative care, we do the cataract there, we do the post-operative care, then we discharge the patient. So it was established with our first patient was in 2013, and until now we managed to do about 35,000 of cases. And the waiting time in the hospital about 4 months. In the center, we're able to short it into 2 weeks. So that is one of the good collaboration. The other private public partnership is the collaboration with the Standard Chartered Bank, whereby they give us a good 5-year support for the free intraocular lens that we give to the underserved population. So with that project, actually, we able to cater about 2,000 underserved population with a good, low cost but good quality IOL. I'm sure that is happening, and we even have a study to show the outcome of that lens, even though it's cheap. But the outcome of the vision, and after 10 years, the vision is still stable as compared to the usual conventional intraocular lens. So these are the two initiative of this private-public partnership that I'm happy to share with everybody. So even now, even though it's not as big collaboration as Standard Chartered, we do receive partnership from other smaller banks. They still give, even though it's not for 5 years, but for 1 year, certain amount of support for the intraocular lens. So we're asking for more now, for a better collaboration. We can talk about it later, about my specs, the Malaysia Specs 2030 program.
Yeah.
So I have been going around pitching for the project, and there's a lot of organization actually looking into it and show their interest to support our program as well.
Fantastic. We're about to bring the panel to a close. Yeah, and I was going to say, from the floor, who have we got? If you can just say your name and where you're from.
Robinson from the Secretariat again. I just wanted to ask the panel through you, Chair, to elaborate a bit about the role that technology could play in low resource context. I think it may be something that we could maybe harness more. What are you seeing? Is there anything that we could do, the improvement in screening apps and all these kinds of things? Could it help a lot more to accelerate this thing going forward? And maybe we could, formulate some kind of partnership with that industry a bit more. I don't know. But maybe you could elaborate on what you have seen and learned so far.
Thank you. Perhaps I'll just share some thoughts and then
Go
happy,
ahead.
like to hear from the others as well. The short answer is absolutely. You could make the argument that it could almost not happen unless there is involvement from technology companies with the right technologies, and I think that bit, the right technology, is the crucial bit. I've seen lots of solutions for a lot of different conditions over the years hit the market, become available. All of them work in the context where they were developed. Only a few, in my experience, are suitable for where they are most needed. And there's a lot of considerations that need to go into the usability of different technologies in different places, and their sustainability, considerations in relation to how they will fit within the existing systems, what workforce is needed to operate them, and so forth. So not only there is potential, there is an absolute need for it, but it has to be done carefully and slowly. I don't think it's something that sometimes there's an expectation that a new technology comes out and it's going to be a silver bullet and it will solve everything quickly. I think a more cautious, systematic approach is needed. I've seen screening technologies change the way we do surveys very effectively. Technologies managing school eye health programs that have worked really, really well. And just lastly, I was talking before about DR. There was a time where it was impossible for someone like me, who's not trained medically, to check someone for signs of DR. Not talking about making a diagnosis, but just now there's plenty of solutions out there that I could use to do that myself. So absolutely change, no, the potential for change is huge, but it just has to be done properly.
Fab covered almost everything. Just want to add one thing. Absolutely can be game changer. And then from vision screening to diagnostic to correction, like lots of options are out there. I think what's important is how we can engage with that sector when they are at the R&D stage. Because one of the things that we as an organization are trying to do right now is that start conversation with them at that point so they can be able to integrate some of the concerns that Fab just shared in terms of resourcing and infrastructure platform that are available in the low resource setting, so they can incorporate those sort of aspects within their technology as well. And then we also need to keep in mind that how this whole conversation around data protection can be dealt with, because that's something that we've experienced in quite a few countries, which can hinder the progress of integrating those technologies at the national level. And as we said, that we do not want to end up having parallel system in place when it comes to health information management systems.
Yeah, I mean, great opportunity, but cautious is the message. We're going to come to a close, but I'd like to come back to you, Dr. Fariza, before I throw it to Peter Holland for some closing remarks. We started off asking you a question about why you think it's so important for multilateral organizations like the Commonwealth to lean into the eye health agenda. We've talked a little bit about this global summit on eye health. Keen for reflections on how you think the Commonwealth can support advance towards achieving this global summit.
Right. Okay. So the global summit, as we know, is very important agenda or platform. Global Summit on Eye Health is actually something new, and why we need to have it, because this is the platform as for any other summit where the stakeholders can be together, especially in the case of ours is not only the eye care providers, but those who are actually involved indirectly with the eye care should come together. The non-problem NGOs to also sit down together and we can discuss further about what is actually the challenges, how actually we can improve the eye care and make the agenda as a global agenda. It's not only at the national agenda. So for me, this is a very good platform whereby everybody can be unified on talking about the same challenges, the same issues that they have, share their experience, share their success. And the country, like even for Malaysia, we can learn from the others to see how actually we can enhance our success, how we can sustain our program, how we can improve our initiative that we already have. So this is something that actually I myself looking forward into it, and even our ministry, we already informed him about the coming Global Health Summit and how Malaysia can play a significant role to be part of the summit as well.
Wonderful. I'll take that as an endorsement from Malaysia. I believe we've got one last comment or question from the floor. Over to you.
I'm sorry that I'm making a comment post-closure of the session. I want to come back, I want to come to the school health. The reason I say so is the first part of my professional life was dedicated to eye care. The second half of my professional life is in the vaccination. So in the refractive error correction, the screening by school teachers or this thing really assume that the school system will be the one which should take the lead into introducing this thing. Second half of my life, HPV vaccination is the one which is through the school. It's a gender equal this thing. And I have done quite a bit of analysis on school health. There are only 15 countries which have got some kind of a school health program. One of them is sitting on the panel. Malaysia is one of the mature country on school health. So the missing piece here is that the school health, although it is health, it assumes that there is a lead which is taken by the educational system, which is not true. Means the vertical programs like vaccines or hearing screening or eye screening or life skill education is possible only when there is a systematic approach. Having a nurse in a school doesn't mean school health. So I would say it's a challenge to the individual organizations. Which organization will like to broaden its mandate to come into a school since here the theme is partnership. So it's not just the partnership with the other sectors, but partnership with other programs through the education system.
Yeah, thank you so much, sir. We'll take that as a really important comment, and I think there's a lot of richness in that. Can I ask you, sir, where are you from?
No, my name is Rajkumar. I'm from India, but I live here, and that's the reason I have come to this.
Oh, sure. Thank you, and welcome. Let's move to close, and I'd like to invite Peter Holland, who is the Chief Executive Officer of IAPB, of course, to share your reflections on the power of Commonwealth partnerships, and in particular, why you think the Commonwealth is well placed to help lead us towards a global summit on eye health. Peter.
Thank you, everyone, for joining us today. I think it was really important for us to hold this event because the Commonwealth has been such an extraordinary supporter of eye health over the past few years, and I think it's hard to underestimate the reach and impact of that. The Commonwealth has really been the kind of critical driver of raising the profile of eye health globally. The Commonwealth heads of government were the first group at heads of government level to take up the eye health agenda. And that's really what set us, Brandon, on the pathway to the Global Summit. It paved the way for the first ever UN resolution on vision back in 2021. It drew out, as Dr. Fraser, you've talked so eloquently, the critical importance of eye health, not just as a healthcare issue, but a really crucial driver of social and economic development and economic growth and productivity. But I think most importantly, and what we've really heard today, is those commitments made that started back in 2018 and have continued at the subsequent Commonwealth Heads of Government meetings, they've really driven action across the Commonwealth. So whether that's more than halving the numbers of people at risk from trachoma and the specific developments, whether in Pakistan or Papua New Guinea, scaling of diabetic retinopathy and diabetic eye care services, or as we were just talking about, the growth of school eye care services, it's that leadership and that commitment and the partnerships that we've heard about which has driven that action. And that, I think, is crucially the point of the Global Summit. So we want to take that example and that inspiration, and through resolutions like the UN resolution, globally countries have made commitments to delivering eye care for everyone. So now that's critically what we want to happen. We want to turn those commitments into action, use the example that we've seen across the Commonwealth and take that globally, and use the summit to really drive that action and drive that change. So I'd like to thank, firstly, Dr. Fraser, for your support, obviously here today, but actually your support on eye health over the past many years. And Malaysia really is an inspiration to us and to everything that we're doing. To our panelists, Samrana Fabrizio for standing in. Lane, you're leaving, but I do want to say thank you to you just before you escape, and really the support from the Secretariat. Thank you so much for that. and then finally Brandon for convening this, and again, your support. Thanks so much.